How long do hospice patients live without water? What is hospice care? Hospice care is care given to those who are terminally ill. It is a type of palliative care that focuses on providing comfort, dignity, and support to those nearing the end of their lives. The goal of hospice care is to help patients and their families cope with terminal illness and manage pain and symptoms related to their medical condition. Many people turn to hospice care when medical treatments are no longer effective or wanted. Hospice care is provided by healthcare professionals as well as volunteers. Hospice workers strive to provide physical care, emotional support, and spiritual guidance to both the patient and the family. The services provided vary from person to person, but can include medication management, symptom control, emotional support, spiritual guidance, and even bereavement counseling. Each hospice provider offers differing services, so it is important to research and understand what each provider offers before making a choice. Hospice care is often provided in a patient's home, but in some cases it may also be provided in a nursing home, hospital, or other healthcare facility. The decision on where to receive care should be based on the patient's preference and what services are available. Transitioning to hospice care. When a patient is facing a terminal illness, transition to hospice care may be recommended. Hospice care is a type of support designed to provide patients with comfort and the best quality of life possible during their last days. It is focused on providing physical, emotional, and spiritual care that is tailored to the individual patient and their needs both medically and personally. When transitioning a patient to hospice care, a plan of care will be created in consultation with the patient, family members, and the healthcare team. This plan can be reviewed and updated at any time during the course of hospice care and will address the patient's physical, emotional, and spiritual needs. Common types of treatments provided by hospice care include pain and symptom management, nutritional guidance, wound care, medication management, spiritual counseling, emotional support, and sleep and relaxation therapies. The hospice team may also assist with other tasks, such as arranging for durable medical equipment or helping with activities of daily living. As the patient's condition changes, so too may the scope and nature of the hospice care services they are receiving. When patients are receiving hospice care, they may opt to receive comfort care without nutrition or hydration. This means that the patient has elected to receive medications for pain relief and symptom control, but they have declined foods and fluids. Instead, their priority is comfort and quality of life. This decision can be incredibly difficult for family members and loved ones, who may fear that their relative is not getting proper nutrition or hydration. It is important to remember that this is a decision made between the patient and their medical team, and it is usually one made with the best interest of the patient in mind. The terminal illness of the patient is determined by doctors and other healthcare professionals in order to make certain that hospice care is the most appropriate option. This is done through a detailed assessment of the patient's physical, emotional, and spiritual needs. The choice to receive only comfort care is an important decision made between the patient and their healthcare team. When a patient opts for comfort care, it does not mean that they will be left to suffer from their illness and discomfort. Instead, hospice providers focus on controlling symptoms and providing supportive care, such as emotional and spiritual support, to keep the patient as comfortable and content as possible. The goal of hospice care is to provide patients with dignity, respect, and comfort throughout their end-of-life journey. With comfort care without nutrition or hydration, the patient is given medication to treat pain and other symptoms such as nausea, shortness of breath, or anxiety. Making sure the patient's quality of life remains a priority is key to providing compassionate end-of-life care. How long can an average hospice patient survive without food or water? Making the decision to accept hospice care is a difficult one for any terminally ill patient and their loved ones. When comfort care is chosen, with no nutrition or hydration involved, it can be even more challenging. It's important to understand the implications of this difficult decision, as well as the potential impact on a patient's life expectancy. When patients opt for comfort care without any nutrition or hydration, estimating how long an average hospice patient may survive becomes a little tricky. Every situation is different, as individuals will have different conditions and levels of health which can impact the duration of their lives. Generally speaking, however, It is estimated that in such circumstances, a hospice patient may live anywhere from a few days to several weeks without eating or drinking. Typically, in such cases, the focus of hospice providers becomes more about providing comfort and managing symptoms that arise from not eating or drinking rather than prolonging life. It is essential to recognize that there are both physical and emotional implications of going without food or water. Physically, the body begins to deplete existing energy stores and can become seriously weakened. Vital organs may eventually become affected and shut down. Signs to look out for in a hospice patient who has elected to receive comfort care with no nutrition or hydration include extreme weakness, exhaustion, confusion, and disorientation. In terms of emotional impacts, not being able to eat and drink can be particularly difficult. It is important to talk openly and honestly with your loved one about their wishes during this time. Quality conversations can be incredibly comforting and provide a sense of security and should be prioritized. Ultimately, the decision to accept comfort care with no nutrition or hydration is a personal one that should be discussed thoroughly with a doctor and other medical professionals. It is essential to take into consideration the patient's overall well-being and prior wishes when making a decision. Physical effects of not eating or drinking for a hospice patient. When a hospice patient has chosen comfort care with no nutrition or hydration, the effect on their physical health can be extreme. It is important to understand the types of symptoms that may occur in order to provide the best possible care for a loved one during this time. One of the most common effects of not eating or drinking is dehydration. Signs to look for include dry mouth, sunken eyes, and skin that has lost its elasticity. Patients who are dehydrated may also feel lightheaded or confused due to lack of fluids. It is important to provide sufficient soft drinks or other liquids in order to keep the patient as comfortable as possible. Patients may also experience electrolyte imbalances, which can lead to an irregular heartbeat, confusion, and/or dizziness. It is common for very weak and fragile patients to have difficulty sleeping, and this can be compounded by electrolyte imbalances. An appropriate diet for a hospice patient should take into account these imbalances and make sure to provide adequate amounts of vitamins and minerals. In addition to the effects of dehydration and electrolyte imbalances, hospice patients can become malnourished. This can cause fatigue, increased risk of infection, and feelings of deterioration. A hospice patient's risk of infection should be monitored closely in order to provide the necessary treatments. Finally, a lack of food or fluid intake can cause severe weight loss. This can be distressing both mentally and physically for hospice patients, as they may become weaker and more fragile. It is important to be aware of this and provide any possible comfort measures, such as massage, music, or warm blankets, to keep the patient as comfortable as possible. Choosing to stop eating and drinking as part of hospice care is a difficult decision for both the patient and their loved ones. It is important to understand the emotional impact this has in order to provide appropriate support and meaningful conversations during this time. When it comes to discussing the emotional effects of not eating and drinking, it is important to acknowledge the sadness and fear that may come with end-of-life care. The patient will be faced with not only physical, but also mental and spiritual changes, which can be difficult to cope with. For loved ones, it can be hard to watch a loved one go through this process. Creating space for meaningful conversations about the patient's experience is paramount. It is important to listen without judgment and accept what they say with empathy. Encouraging open dialogue and spending quality time with the patient can help to reduce stress and provide comfort. Additionally, allowing the patient to make decisions about their own care can also help empower them during this time. Providing physical comfort, such as gentle massage or warm baths, can also help to provide relief from physical pain. Accepting the patient as they are, without pushing them to change or simply trying to fix anything, can also go a long way in providing emotional support. Choosing to end nutrition and hydration can cause a range of emotions, and it is important to be mindful of this. Acknowledging the patient's feelings and helping them to express themselves can be an essential part of the comfort care process. Allowing the patient to talk openly about their experience can bring peace of mind while paving the way for meaningful conversations and quality time. Providing comfort care without nutrition or hydration. When a hospice patient chooses the option of comfort care with no nutrition or hydration, hospice providers focus their attention on other areas of care. This includes managing pain and symptoms, providing emotional and spiritual support to the patient and family, coordinating all care, and helping to ensure that the patient's wishes for their end-of-life care are respected. Hospice providers prioritize pain management and symptom control. This includes prescribing medications and other treatments, such as physical therapy or massage, to keep the patient comfortable. They will also coordinate any home medical equipment needed, such as oxygen tanks or hospital beds. In addition to physical care, hospice providers consider the emotional and spiritual needs of the patient and their family. They provide emotional and social support, such as individual and group counseling. They may also refer families to specialized grief counselors if needed. Spiritual care is also part of the hospice package and involves providing spiritual guidance and assistance in understanding the hospice process. Lastly, hospice providers help ensure that the patient's wishes for end-of-life care are respected and followed. This includes creating an advance directive or a living will, which states the patient's wishes in the event that they are unable to make decisions on their own. It also involves navigating important legal and financial matters that may arise during the hospice process. Overall, hospice providers understand the importance of providing compassionate care that meets the physical, emotional, and spiritual needs of the patient and their family. The emotional impact of comfort care. It's important to remember that the emotional impact of not eating or drinking can also be difficult to cope with. As the body weakens, patients may become anxious or depressed, especially when faced with the prospect of leaving their loved ones behind. Families should consider having quality conversations with their loved one during this time. Reassure them that they can remain in control of their own decisions and that you are there to support them. Ask questions about what they need and accomplish, and remind them of the things they cherish in life. Share stories and memories of good times, and help them to live fully in these moments. It's also important to consider the psychological and spiritual aspects of the journey. Death is not something to be feared, but can be seen as a transformational process in which the soul continues to live through its loved ones. If available, spiritual and bereavement counselors can provide additional insight and support. When a hospice patient elects to receive comfort care, they are choosing not to take nutrition or hydration. This decision significantly impacts their life expectancy due to the physical effects of not consuming food or liquids. As their body slowly runs out of these essential nutrients, various changes can occur within their system as well as the surrounding environment. While each individual is different, it's commonly accepted that an average hospice patient with no access to food or water can survive for several weeks up to a month, with varying degrees of discomfort. Though the amount of time that a hospice patient can survive without food or water depends largely on the individual's overall health and condition, there are some physical effects that should be expected in all cases. Generally, as the body begins to weaken, an individual's skin may lose moisture and begin to dry out or become discolored. A decrease in mental abilities can also occur, making it harder for the patient to communicate. The hospice patient may experience an increase in fatigue and lethargy as their energy levels decrease, as well as difficulty breathing, which could potentially lead to cardiac arrest. It's important to remember that not eating or drinking does not only have physical effects on a hospice patient. It can also create emotional stress and discomfort, making it difficult for them and their loved ones during this time. Therefore, having quality conversations and providing emotional support becomes more significant than ever during this period. When should a family consider hospice care for a loved one? A family should consider hospice care when a loved one is diagnosed with a terminal illness and has a prognosis of 6 months or less if the illness runs its normal course. Hospice care is also an option when the focus shifts from curative treatments to comfort and quality of life. Remember, each patient's experience is unique, and hospice care teams are there to provide personalized support tailored to the patient's and family's needs during the end-of-life journey. Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.